Hello. During the next few minutes, we're going to explore various aspects of temporomandibular joint, or TMJ, disorders. The purpose of this video is to help you understand a method of treatment that may be right for you. And because no procedure is without possible risk or complication, we'll inform you of the potential risks or complications associated with your treatment. Let's begin by reviewing some questions that many patients ask. Then we'll provide the answers and explain your treatment options. True or false? Painless clicks in one or both of the TMJs can be early symptoms of a disorder. Splint therapy is a treatment option for TMJ disorders. Is this true or false? True or false? TMJ disorders can sometimes be corrected through stress management techniques. Chewing hard foods or gum will not aggravate TMJ disorders. Is this true or false? Is the following statement true or false? A slightly noticeable skin incision line is a risk of TMJ surgery. These questions are related to areas of discussion in this video, including diagnosis, treatments, alternative treatments, and risks. Now, let's explore these areas in more detail.
The temporomandibular joint, or TMJ, is one of the most constantly used joints in the body, used during eating, talking, yawning, and other common activities. The TMJ is really two complex joints, working like a ball and socket at the point where the lower jaw hinges against the bones on either side of the skull. Sometimes an injury to the joint can result in symptoms of TMJ disorders, but disorders more commonly arise through stress or habit-related activities such as teeth clenching or grinding. Early symptoms of TMJ disorders include minor painless clicking, which gradually becomes more pronounced over time. It is important to pay attention to these early warning signs, as prompt diagnosis can increase the likelihood of effective treatment. A proper temporomandibular joint function depends on the harmonious working of the surrounding muscles, bite, and jawbones. A problem in any one of these areas can result in TMJ disorders. When muscles surrounding the TMJ are tight, usually due to stress habits such as teeth clenching, pressure is placed on the TMJ, damaging the disc portion of the joint. Bite problems, such as overbites, can place the condyle, or the ball portion of the joint, in an unstable position. Impact injuries can cause the disc to slip out of position, creating discomfort during simple activities such as talking and chewing. When patients seek help for a possible TMJ disorder, we obtain a thorough medical history, including information on the individual's lifestyle, overall health, diet, and medications. We then conduct a physical examination to test for painful muscles, joint noises, and abnormal jaw movements. Pinpointing the source of the TMJ problem may require the patient to undergo one or more diagnostic x-rays, which provide detailed images of the bone and soft tissue changes in discs and ligaments. The oral surgeon reviews all findings with the patient to develop a mutually acceptable treatment plan. Before treatment begins, the oral surgeon also explains what the patient can realistically expect from the treatment.
After my TMJ disorder was diagnosed, I was relieved to learn that there was a lot I could do to alleviate the problem, even though I can't control my hectic lifestyle. It's good to know that there are some things I can control. I felt better just knowing that I could participate in my own treatment.
Simple changes in habits, such as giving up hard foods and chewing gum, can enable the temporomandibular joint to rest, often bringing relief. Other remedial therapy can include the use of ice packs, moist heat, gentle flexibility exercises, and over-the-counter medications. When these methods do not adequately address the problem, additional treatment may be indicated. Such treatment may include a bite plate, called a splint or a night guard, to help prevent clenching or grinding and reduce muscle tension. In some cases, orthodontics or restorative dental treatment can relieve joint pressure by improving harmony among the muscles, joint, discs, ligaments, and teeth. If, over a period of time, the patient does not obtain relief through these methods, surgical reconstruction of the joint may be an option. Now, fortunately, only a small percentage of TMJ patients require surgical treatment. However, in cases where it is recommended, patients need to understand the basic components of the surgery so they can ask informed questions about the procedure. Arthroscopy is a form of surgery in which we make a small skin incision and insert a tiny tube called an arthroscope. Through this viewing device, the surgeon is able to see the interior of the joint and perform minor surgery such as releasing scar adhesions and fleshing out the joint. This technique is commonly used in knee surgery. Sometimes, arthroscopy reveals the need for surgical reconstruction of the joint. We accomplish more complex reconstruction of the temporomandibular joint through a surgical procedure called arthroplasty. During this surgery, we make an incision in front of the ear, expose the joint, and repair the disc or ligament. Extensive joint damage may require additional surgical procedures. Now, these can include bone recontouring, replacement of the disc with grafted material from another part of the body or with artificial materials. In rare cases, we may need to artificially replace the entire joint. There's other procedures we can do here in the office, but this type of surgery we always perform under general anesthesia. Now, this means that you will not be conscious during the surgery.
So will the surgery have to be done in the hospital?
That's right. The procedure is just too complex to be done in the office.
There must be risks.
Yes, Nancy, and I want to go over the risks with you in some detail. Now, please, stop me whenever you have questions or you need further clarification.
Count on it.
All right. The risks of general anesthesia can include nausea, vomiting, nosebleed, tooth damage, hoarseness, prolonged recovery, and pneumonia. And, as with any general anesthetic, it may be potentially fatal. Now, some side effects can be anticipated following the surgery. Now, these can include bleeding for a few hours, swelling, discomfort, muscle stiffness in the jaw area, and temporary bruising of the face and beneath the sides of the jaw.
So far, we've reviewed diagnosis, treatment, and alternative treatments. As with all surgical procedures, there are also known risks and complications. Your oral surgeon will explain these risks to you prior to surgery. If you have questions or need further explanation, always be sure to ask.
Well, first there's the risk of infection. In any surgery, bacteria are always a threat and may cause infection. However, the infections usually respond to antibiotic treatment. In cases of severe infection, prolonged treatment may be necessary.
Are there other complications?
Depending on the difficulty of the surgery, there are a variety of risks. These include a slightly noticeable skin incision line and possible damage to sensory or motor nerves in the area. The most significant risk comes from motor nerve injury, which may cause temporary or permanent facial muscle weakness, causing an inability to wrinkle the brow, raise an eyebrow, or tightly close your eyelid. These changes are both cosmetic and functional. Another possible risk of TMJ surgery is continuing discomfort in various areas of the face. Patients should be aware that surgical treatment will not necessarily result in total relief from all these symptoms. And regardless of the treatment, patients may not improve, and their condition may even become worse, especially if there's a return to stressful habit patterns. Our goal is to help patients understand their diagnosis, treatment plan, and the risks of treatment. Patients are encouraged to, at all times, entertain realistic expectations about the effectiveness of treatment and its likelihood of alleviating TMJ problems. I want you to read this, make sure you understand each paragraph. Informing patients of the risks associated with surgery allows them to make decisions about their treatment and have realistic expectations about the results.
Before we close, let's take a few moments to review the questions posed earlier. True, painless clicks in one or both of the TMJs can be an early symptom of a disorder. Yes, splint therapy is a treatment option for TMJ disorders. In some cases, TMJ disorders can be corrected through stress management techniques. Chewing hard foods or gum will in fact aggravate TMJ disorders. And a risk associated with TMJ surgery is a slightly noticeable skin incision line. Please consult with your oral surgeon if you'd like further explanation on any of the information in this video, or if you have questions about topics that may not have been included. During the informed consent process, you'll be asked to read and sign a surgical consent form for the procedure just described. Your oral surgeon is committed to not only caring for your physical needs, but also providing all the information you need to make an informed decision about your course of treatment.